Hi, it's Sharon. We're going to do a class for you seniors, courtesy of the Council on Aging, to help you stay in shape during this pandemic. Remember, at any point during the class, if you don't feel well, if your heart starts to flutter, or you feel terribly out of breath, please stop immediately and consult your doctor. Alrighty, let's get started in the chair. You're going to have a nice sturdy chair and you're going to lean your back against it. Here you go. Now, you're going to have your bum pushed back against the chair. Sometimes I have you slouch and I have your bum back against the chair. Not entirely flush, but I don't want you coming forward. What we're going to do, we're going to bob the knee up and down. I want you to do your best and work that nice hip flexor. So we're going to start on this leg here, which is the left, because I'm opposite of you, bringing up that left knee, and I want you to bob it up and down without the foot touching the floor, and 3, going for 30, 4, 5, good, 6, 7, 8, 9, good, 10, 11, you're breathing, 12, 13, 14, 15, 16, 17, 18, 19, 20, 10 more, 9, 8, 7, 6, 5, 4, 3, 2, and on 1, I want you to bring it up, I want you to hold it there, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Did you feel that? Should be right about there. Now we're going to come over to the right knee, bringing that knee up. We're going to go for 30 here. Remember, don't let that foot touch the floor. 30, 29, 28, 27, 26, 25, 24, 23, 22, 21, 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, good, 7, 6, 5, 4, 3, 2, bring that knee up, holding, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, relaxing. Again, working those nice hip flexors. These hip flexors right through here help you to lift the knee as you're walking so that you don't shuffle. Okay, now I'm going to have you sit straight up in the chair. This time your back is going to be away from the chair, like so. Now we're going to work on your arms and shoulders. This is a very simple movement. I'm going to bring the arms out to the side, palms facing down. I'm going to bring the arms up, palms facing together, and back down. Try to keep the arms straight. Don't let them flop like that. Keep the arms straight. We're going to go for one count of 35. 35 and down. 34, 33, 32, 31, parallel to the floor, 30, 29, good, 28, 27, 26, 25, 24, 23, 22, 21, 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Relaxing the arms, inhaling through the nose, exhaling through the mouth. Good. Next, we're going to come back to lower body. So for this, I'm going to have you stand up behind your chair. I'm going to show you the side view, but I want you to keep that chair right there in front of you. Okay, so the side view is going to look like this. You're going to have the toes pointed out to the side. And I want you to push the chair in front of you a little bit so that your torso is leaning forward over the chair. So my bum is out that way, right? So I want you to just drop the bum down and back up. What I don't want you to do, if you can, you don't want to move forward like this. This is very bad positioning and places unnecessary stress on your knees. And with this exercise, we're looking to target the glutes and the hamstring. The glutes and hamstring allow you to push off with the ball of your foot as you're walking. So you're going to stick that bum out, keep those feet nice and flat on the floor, and dropping the bum down and back up. Let's go for 30, 29, 28, good, 27, try not to go too quickly, 26, 25, good, 24, dropping down, 23, 22, 21, breathing, and 20, 19, 18, good, 17, 16, 15, should be feeling the burn, 14, right through here, 13, good, 12, 11, perfect, 10, 9, 8, let's try to slow it down, 7, and 6, 5, almost done, 4, 3, 2, and can you finish the last one? And what? Can you hold it there? 5, 4, 3, 2, and 1. You go ahead and have a seat. You should feel that burn come off of the thighs. So when you have the toes and knees pointed outward like that, we're working the outside component of your quad. Okay, going to have a seat. We're going to come back to upper body. So I want you to breathe a little bit, inhaling through the nose and exhaling through the mouth. Remember, one of the corollaries or side effects, if you will, of working out is that your body is able to function better. What does that mean? For example, when you work your upper torso, your arms, your shoulders, your abs, it actually assists with your breathing if you ever need assistance. This occurs if you're sick or have an upper respiratory infection, anything like that. Whenever your lungs are compromised, you are unable to effect what's called passive breathing. You just breathe without using any of your muscles. When you need to use your muscles to inhale or exhale, you're using different, what are called accessory muscles to come in to assist. When these muscles are weak, the ability for the body to come in mechanically to assist your breathing is compromised. Whenever your breathing is compromised, your heart is also compromised because it all works together. So remember, stay in shape. Okay, enough of that rest. We're going to come back to upper body. Now we're going to work the tricep, the back of the shoulder, which is rather the shoulder and the back of the arm right here. So working the tricep and the infraspinatus. Don't worry about that name, you've got one. Okay, seated upright in the chair. You're going to have your palms facing the back of the room. Now you're going to bring your elbows up just like a scarecrow. There you go. And back down. One count of 30. 30. Keeping the chest up. 29. 28. 27. 26. Breathing. 25. 24. 23. 22. 21. 20. 19, 18, good, 17, try to pull the belly in, 16, 15, 14, 13, 12, 11, 10, 9, good, 8, 7, 6, 5, 4, good, 3, 2, and 1. So again, when you're pulling the elbows up, you're working the back of the shoulder, that rear delt, and also part of the rotator cuff called the infraspinatus, and also the tricep. In the frontal plane, when you're pulling yourself, say you're boarding a bus and you're pulling yourself up, the action of pulling yourself in the frontal plane is facilitated in part by the back of the arm. When the tricep is weak, the stability of your grip and the ability to pull yourself up will be affected. So keep this in mind. If you know that your arms are not as strong as they should be, try to be aware that if you're pulling yourself up, you can't rely on that action entirely to, say, walk up the stairs. So in that case, if you're walking up the stairs, as opposed to leaning back and pulling yourself up, you would lean forward and use your arms just to more or less stabilize your position, as opposed to relying on yourself to pull yourself up. Okay, enough of that rest. Coming back to lower body. Now we're going to work on the interior of the thigh. This is the adductor complex. These muscles allow you to keep your knee up and stand on one leg. Okay, so you're going to have your back against the chair. You can slouch a little bit or not, your choice. And you're going to bring the knee up and over. So, if you cannot cross your leg over, no problem. Just bring the knee up and meet those legs together. So we're just looking for the action of closing that gap and bringing the legs together so that we affect these adductors. We're going to go for one count of 35 on each side, starting on the left side. Ready? This is 35. We're going to place the whole foot on the floor. 34. 33. Good. 32, dropping the knee out. 31, so I don't want to see this, okay? And 30, because I'm watching ya. 29, 28, 27, good. 26, 25, perfect. 24, 23, and you're breathing. 22, keep breathing. 21, and 20, 19, 18, 17, 16, 15, perfect, 14, 13, 12, good, 11, 10, 9, tapping down, 8, 7, 6, good, 5, 4, good, 3, 2, and 1. Now I'm going to have you bring the knee here, and I want you to hold this position for a count of 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Very good. So the activation you should have felt is the adductor magnus in part right through here. We're using other muscles, but the primary synergist muscle is going to be that one. Okay, now we're going to come over to that right leg. So we're going to go for 35 here, bringing out the leg and crossing over. Remember the modification. You can bring the knees together like that. Ready? 35, 34, 33, 32, 31, and 30. Good. 29, 28, 27, 26, 25, 24, 23, 22, placing the whole foot down, right? And this is 20, 19, 18, 17, good, 16, 15, 14, 13, 12, 11, keep breathing, 10, 9, good, 8, 7, we want that muscle to get tired, 6, 5, 4, good, 3, 2, and 1. crossing over. Now we're going to bring that knee up, holding 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. So depending on your physical baseline, you'll notice as you get stronger in, for example, in this exercise, we're working the adductors. So we do a count of 35. Let's say you start to feel it at maybe 5 in or even 10 in. As the muscles get stronger, this time will be elongated. So as you get stronger, as opposed to getting tired at the 10th rep, maybe you won't start to feel it until the 30th. It is at that point where you must adjust up the number of reps or the resistance level. This is very, very important when you exercise. A lot of people who kind of train themselves don't really get that. You must adjust your workout to how your body is responding. Very quickly, if you were doing a bench press, for most people, you wouldn't start out trying to bench press 250 pounds. You would start maybe at a lower weight until your muscles acclimate and until you have proper form, and then you can progress from there. This is important to minimize injury. Okay, we're going to come back to upper body. Let's work the front part of the shoulder. For a lot of people, this is very tough. Now, if you're home and you have weights, I would get maybe a 1 to 2 pound weight. It sounds light, but you'll see in a minute. It's heavy enough. So you're going to sit up in the chair with the knees and feet apart. Your back is nice and straight. You're going to pull the belly in and up. And you can cross your hands like this and interlace your hands like this, or have them straight out, doesn't matter. But you want to keep the arms straight. So we're going to come down. Notice when I come down, I bring the chest up, right? Because when the chest is up, I'm using the pec major for the assist coming up, right? We're going to do one count of 40. 39, keep that chest up. 38, chest is up. 37, not this stuff, right? 36, 35, good. 34, 33, 32, 31, and 30, 29, 28, 27, 26, 25, 24, 23, 22, 21, 20. Keep the arms straight. This is 18, 17, 16, 15, 14, 13, 12. Let's slow it down a little bit. 10, 9, 8, a little tougher, isn't it? 7, 6, stay with me, 5, slow coming down, 4, good, 3, 2, and 1. Relaxing, so you're going to feel it right through here. So in the frontal plane, right, as we come up, so this is called flexion in the frontal plane. We're working the bicep, and we're working that anterior delt. We're also working a little bit of the back too. So why did I say slow it down? Because when you slow down a movement, this helps to affect greater strength. Now, sometimes people ask, well, should all exercises be slow or fast? Complex answer to that one. It depends what you want to achieve. If you want to achieve strength, you want to slow down that movement. If you want to achieve agility, flexibility, the ability to respond quickly, you're going to have faster movements. This is evidence when you see professional athletes doing very quick movements that require strength as well. This is so that they can be agile enough and also have enough strength to affect different movements depending on the sport. For the purposes of this class, I'm going to interchange the two because as with a professional athlete, you do need both strength with fast moving and also with slow moving action, depending on what may be required of you. Okay, we're going to stay with those arms. Now let's work the side delt. The shoulder has three parts: anterior, medial, and posterior, or front, side, and back. Okay, you're going to have your arms at your sides. For this, I want you to try to keep the chest up again. Now, the starting position is going to be here. You want to keep those arms straight, and it's going to flap just like a bird, just like that. One count of 40, 39, 38, 37, don't come up too high, 35, 34, 33, 32, 31, chest is up, 30, 29, 28, no slouching, 26, 25, 24, 23, 22, 21, 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. You're going to hold it right there. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good. You should have felt the burn in that medial delt. So, going back to the example of pulling yourself up the stairs. When you hold, let's say, a railing, right? In this position, if you're pulling yourself up, remember you're using the back of the shoulder, but to stabilize the position, you're using the short head of the bicep and you're using that side delt. So I don't know if you're able to see, but if I engage it, this will actually pop a little bit. Okay, so remember, everything in the body is intertwined. Everything helps each other. Okay, we're going to go back to legs. So I'm going to have you stand up behind your chair. We're going to have a little bit of fun. Well, I think it's fun anyway. All right, we're going to do our speed drill. You can do this in the chair or stand. It's up to you. Standing behind the chair, you're going to tap your feet and come out and in just like that. And when I tell all my classes, you're going to let the bottom get a little jiggly. You're going to relax and let those feet and legs move. If you have knee problems, no problem. Stay seated in the chair and just do the movement while seated. I'm going to go for one count of 20. Firm grip on that chair. Remember, if you need to take a seat, please do so. We're going to start by tapping the feet. Out and in. 20, 19, 18, 17, 16, 15, 14, 13, 12, good, 11, 10, 9, 8, 7, 6, 5, good, 4, 3, 2, and 1. Now you're going to stay right there going for a count of 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Have a seat. How did that feel? So here you can see a quick moving exercise, right? To give you a little bit of agility. So we move the feet quickly so that if you ever lose your balance and the feet need to move quickly, your brain remembers how to do that. Inhaling through the nose, exhaling through the mouth. Let's do a little bit of flexibility. Seated upright in the chair, we're going to do a backward arm circle. This is to help get flexion through this area here, the upper pec girdle, which inserts into the shoulder. So you're going to have the shoulders back slightly, chest up, relaxed arms. Now with this movement, everyone is different. What is important is that you don't force the movement or force the range. So I'm going to come to the side here. So if you can only do this, that's all you do. If your arm can come back a little bit wider, then do that. One more count of 20. 19. Relaxing the chest as you come back. 18. Letting the chest come forward. 17, bringing the chest forward. 16, 15, 14, good, good, good. 13, 12, 11, 10, 9, 8, 7, 6, 5, perfect, 4, 3, 2, and on 1, if you feel comfortable, I should bring the arms up. If you feel comfortable, I want you to drop them back, palms are facing forward. And I want you to try to bring the chest up, holding this position for a slow count of 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Coming forward. Excellent. This is a great stretch if you find yourself in front of a computer or if you have work where you're at a desk all day. The tendency is to drop those shoulders forward. It's normal. Everyone does it. Sometimes you don't even notice it, but you must counteract that position by doing movements which are externally rotated, such as this. This helps to keep this area through here nice and flexible. Remember, going back to what I was talking about, breathing. If you ever need mechanical assistance from your body, you want to have these muscles well worked in to be able to do that. Okay, we're going to do a little bit of ab work. Oh, and abs are very important for this mechanical breathing. Specifically, wait a minute, exhaling. I always forget that. Specifically, exhaling. So when you exhale, you're using your abs. So we're going to do that right now. So I'm going to bring the chair to the side so you can see. So for this, you're going to start with both knees and feet together. Now, what I want you to do, you're going to bring your back to the chair like that. Up, and then back up again. That's kind of weird, isn't it? Let's try that again. Keeping the back straight, we're going to drop back and coming back up again. Well, let's make it a little bit more interesting, shall we? We're going to do one set of 5, bringing the shoulders back and up. Then I'm going to have you to do a static hold. Okay, so we're starting position, knees and feet together. Relax shoulders, bringing the tummy in, pulling in and up, keeping the chest up. You're going to drop back. You don't need to touch the chair because you may not be able to, but that's okay. So you just want to drop back so you're forcing the abs to engage, okay? And back up. And this is 3. So you're going to feel that tight, right? And 4. Good. And we're going to do one more, and 5. Now what I want you to do, take a breath. I want you to take that breath, drop back without touching the chair. I just want you to hold this position. Just hold it. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. So you're going to feel it through here, the rectus abdominis. So in terms of mechanical breathing, the abs, internal and external obliques, and a muscle called the QL allow you to effect mechanical exhalation, coughing. So if you ever notice when you have a coughing fit, you may cramp in your abs. That's because the coughing or the expulsion of air is so much that the abs are coming in to assist, and that's why you may cramp in your abs. So the abs are very, very important in that case to help you affect coughing. Coughing is important because it allows you to clear your lungs. When you have ineffective or what's called non-productive coughing, you can have debris and material left in the lungs which may cause an infection. So coughing, very, very important. Okay, we're going to stay with abs. Let's do a little bit more. So I'm going to turn the chair forward. And we're going to do something a little different. You're going to sit straight up. Your arms are at your sides. And I want you to pull your belly in as much as you can. Pull it in. I should show you the side view. So I want you to pull the belly in as much as you can and hold it for a count of 5, 4, 3, 2. I want the belly come out again. Let's do that 2 more times. Seated straight up, pulling the belly in, and you can do the standing as well. Why don't I show you standing? So you're going to pull the belly in. I'll bring my arms out so you can see. Pulling it in and holding it there. 5, 4, 3, 2, and 1. And relax. And again, pulling the belly in, holding. 5, 4, 3, 2, and 1. And relax. We only did 3 sets of that because it's a little tough. When you pull your belly in like that, you're working the deepest muscles of the abs called the transverse abdominis. These are the ab muscles that are closest to the spine. So this is an exercise to help, again, with those deep muscles. People who do yoga or Tai Chi, depending on the movements, access these muscles as well. And again, the abs help you with that expulsion of air if you ever need to cough or anything like that, with that mechanical exhalation. Okay, we're going to stay with abs and do some more hip flexion. So I need to turn my chair around again. This is going to be a straight leg kick in the chair. So you're going to slouch forward, and I want you to extend out that right leg. And I want you to try and point the toe. So I actually do this without my shoes. So I'm going to take my shoes off. And if you're home, your shoes may already be off. Okay, so when your shoe is off, you're better able to point that toe. This is working the flexion muscles of the feet, which is great. So you're going to slouch forward, holding onto the chair, keeping that leg straight. You're going to bring the leg up and down. See how easy that is. I'm kidding. Okay, we're going to go for 1 count of 20. Don't worry how high you bring your leg up. Just keep the leg straight and do your best pulling in those abs. 20, 19, 18. Keep the leg straight. 17, 16, 15. Pointing the toe. And 13, 12. 11, slow going down. 10, not too quickly. 9, 8, 7, good. 6, pulling the belly in. 5, 4, good. 3, 2, and 1, bringing that leg up. Can you hold it there? 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Perfect. How did you do? I'm going to turn the chair around. Now we're going to work that left leg. Same idea here. Bringing the bum forward, the back's against the chair. Pointing the toes. So you're going to feel a tightening in the calf as well. Going for 20. Pulling the belly in and up. 20. 19. Good. 18. 17. 16, good, 15, 14, and you're breathing, 13, 12, 11, 10, 9, perfect, 8, 7, 6, 5, good, 4, 3, slow it down, coming down, 2, and 1. Now bringing that leg up right there. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Excellent. So again, working the hip flexors, the thighs, and when you point the toe, again, working the flexion muscles of the foot and also the calf. Now, here's a little trivia. The calf or the gastrocnemius is also known as the second heart. Why? Strong calves help to facilitate blood flow back to the heart. This is another great reason. Please incorporate walking in your exercise regimen every day. And when you're walking, you want to walk up hills, down hills, on grass, on concrete, different surfaces. Because these different surfaces activate the brain. You didn't know that, did you? Activate the brain in different ways to actually sort of accommodate the surfaces and your foot movements. This is why for toddlers and very small children who are just learning to walk, doctors often suggest that children walk on different surfaces barefoot. So for a child to walk on the kitchen floor and then maybe on a carpet is very important for activating their brain. Okay, I'm going to put my shoes back on, and we're going to head to our next exercise. Feel like Mr. Rogers here a little bit, and we're going to work on our upper body. All right, so we're going to work now on the pec major and the anterior delt. So you're going to have your knees and feet apart, clasp your hands together like so, and you're going to drop the elbows together, just like that. And you're going to bring the elbows up and right about here. So you're not coming down here. You're going to keep it up right there. And you want the elbows away from you, so you don't want this. Chest is up, and you want those elbows away from the body. We're going to go for one count of 30. 30, 29, 28, 27, 26, 25, 24, 23, 22, 21, 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and we're going to bring the arms up. Hold it there, elbows together. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Whew, should have felt it here, and you may have felt it here. So where do these pec muscles come into play, right? Where do they come into play? As simple as fastening your seatbelt. So when you sit in a car and you have to reach up and cross over and fasten the seatbelt, the action of coming across the median is going to be facilitated by that pec major here. When the pec major is weak, you're going to have problems maintaining this position, for example, fastening your seatbelt and trying to fasten it, right? So what you'll find is that the pec is weak, you'll have to rest for a moment and then try to fasten the seatbelt again. So pec comes in with this crossing action like that. Alternatively, if you're in the passenger seat, right, you grab it and you bring it across. It can be very difficult if the pec is weak. The pec also helps pushing yourself. For example, if you were on the floor and you needed to push yourself up. The pec helps to dissipate the force. When the pec is weak, more force goes to the shoulder. If you already have a shoulder issue, this can exacerbate it because now the shoulder cannot accommodate the stress of your body weight. So again, staying in shape has a multitude of sort of ramifications, And this is why you want to kind of have an overall physical exercise regimen. You want all parts of the body involved. Okay, I let you rest long enough. We're going to come back to lower body. We're going to work on a little bit of balance now. I'm going to have you stand up behind your chair. And this one is very simple. You're going to lean forward, standing on the chair. Knees and feet together. This one's easy. I just want you to bring up the right left knee. Hold it there for a count of 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4. Keep breathing. 3, 2, and 1, and down. So what you're going to notice is that although that left knee was up, you're feeling the opposite glute become engaged. I'm going to try that again. Same side. Holding onto the chair, leaning forward. Bring up that left knee, holding it there. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good. We're going to stay on that side. This time we're going to extend the leg. Inhaling through the nose, exhaling through the mouth. Try not to lean to the opposite side, cantilevering that position. Try to keep the torso straight. You're going to extend out the left leg, pointing the toe. Without forcing it, just bring up the leg as high as you can. Holding it there. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. We're going to do that one more time. Inhaling through the nose, exhaling through the mouth. Very good. Pointing the toe. Bringing the leg up. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. We're going to come to that other side. I know you're asking yourself, how is this balance we're holding on to the chair? Doesn't matter. Remember, balance is a function of strength. It's a very short hop, so to speak, from this to that. The purposes of building strength, you don't want to focus on balance per se. You want to focus on your strength. When you work on your strength, balance takes care of itself. Notwithstanding issues with the inner ear and maybe neurological issues, that is another situation. But from a mechanical standpoint, the better your strength, the better your balance. Coming over to the right side now, we're going to bring up that right knee, holding it there for a count of 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10. Breathe. 8, 7, 6, 5, 4, 3, 2, and 1. Oh, you didn't know your leg was so heavy, did you? All right, this is our second set. Inhaling through the nose, exhaling through the mouth. Bringing that knee up for a count of 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Bringing that foot down. Great. And again, remember, when that leg is up, we're actually working the other leg as well. Now, our two sets with an extended leg. Bringing out the right leg, pointing the toe, and bringing that leg up as high as you can. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11. Don't try to balance. 9, 8. Just keep the leg up. This is 6, 5, 4, 3, 2, and 1. Bringing that leg down. Good. Inhaling through the nose, exhaling through the mouth. Remember, hold on to that chair. We're just working on strength, right? Inhaling through the nose, exhaling through the mouth. Bringing that right leg out, pointing the toe, bringing it up. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good. We're going to stay with balance. Now we're going to do an alternating knee raise. So nice firm grip on the chair. These chairs are kind of weird, holding it like this or whatever, depending on your chair. It's going to have a nice firm grip. So we're going to do an alternating knee raise from a standing position. Holding on to the back of the chair, we're going to go for one count of 25, 25, 24, 23, 22, 21, 20, 19, good, 18, 17, 16, 15, 14, excellent, 13, and 12, 11, breathing, 10, 9, 8, keep breathing, 7, 6, 5, good, 4, 3, 2, and 1. Good. You can go ahead and take a seat. We're going to come back to upper body. We're going to target the tricep yet again. So for this, I'm going to turn the chair to the side, like so. So seated upright in the chair. So again, we're targeting the back of the arm. Oh, so I get this question a lot. People say, oh, the back of my arm is so flabby. What do I do? So after a certain age,